is abdominal examination? Abdominal examination is a physical examination that includes inspection, palpation, percussion, and auscultation of the abdomen. The apparatus needed are
Selamat tengah hari Encik. Nama saya Thanos, pelajar perubatan Uniza. So, boleh tak saya tahu nama dengan umur?
Nama saya Mursyidi,
Okey,
umur 22 tahun.
22 tahun. So, boleh tak saya tahu kenapa Encik datang hari ini?
Saya datang sebab sakit perut tu.
Sakit perut. So, disebabkan Encik kata ada sakit perut, kita nak buat satu examination lah terhadap perut Encik. So, di mana Encik kena masuk dalam bilik, sedia buka baju semua dan boleh panggil saya. Saya akan bawa satu chevron untuk menemani Encik lah sehingga prosedur tu habis. So, saya akan cek perut, saya akan tengok, mungkin saya akan sentuh-sentuh sikit, nak tahu sakit dekat mana semua tu. So, Encik setuju tak?
Saya setuju, doktor.
Setuju lah. So, Encik boleh masuk dalam bilik and bila dah ready, boleh panggil saya lah.
Saya masuk sekarang.
Ya, boleh.
indication for abdominal examination are abdominal pain, distension, nausea or vomiting, diarrhea or constipation, changes in appetite or weight, jaundice, or suspected organomegaly, ascites or mass.
Ready, doktor.
Now the patient is ready. We have to introduce our chevron to the patient. So, Encik, ni adalah pelajar perubatan Uniza jugalah. Nama dia Amir Mursyidi. Dia akan menemani Encik sehingga prosedur ni habis. Okay? So, saya nak Encik baring atas katil ni. Boleh tak?
Boleh, doktor.
Okay. Boleh buka sebelah mata. So now patient is lying in a supine position. We have to make sure there is a private space between doctor and the patient. Once the patient lying down in supine position, we have to ask the patient whether he is in a comfortable position or not. So Encik rasa selesa ke?
Selesa, doktor.
Okay, selesa. So we have to cover the patient. Okay. Angkat perut sikit. So next we proceed with exposure. Adequate exposure is a must. So theoretically we have to expose the patient from the nipple line to mid-thigh. Since we consider the patient modacity, we are only exposed from the sternum up until suprapubic area. Okay, now patient in exposed position, we have to start the examination with hand washing first. When we make sure the patient is lying in supine position in comfortable way, we'll start with the inspection, where the inspection start from the end of the bed.
During inspection, look for sign of discomfort, pallor or jaundice, and check for medical devices. Next, inspect where the abdomen is flat or distended. Is there any scars, striae, rashes, visible mass or hernia, and any dilated vein, pulsation, and peristalsis.
Once we're done with the inspection, we will ask the patient to face the opposite side of the examiner and ask the patient to cough. So, Encik boleh pandang ke kiri dan boleh batuk 2 kali untuk saya. Lagi sekali. So, after inspection and cough impulse, we will proceed with superficial palpation and deep palpation. Before the palpation, we have to ask the patient whether he or she got any pain or not. If the patient said pain, we have to avoid the area first and then we have to palpate away from the region where the patient pinpoint pain. So, Encik ada mana-mana sakit tak dekat perut?
Tak ada, doktor.
So, since the patient say no pain, we will start from anywhere, but we have to palpate all the nine region of the abdomen. Then we proceed with deep palpation. When we're doing superficial palpation and deep palpation, we have to look at the patient face for the reaction. Okay, then we have to palpate for organomegaly. So I will start with hepatomegaly. Okay. So when we look for organomegaly, we have to ask the patient to inspire. During the inspiration, we have to palpate for any organomegaly or not. Okay, cik boleh tarik nafas, hembus, tarik nafas, hembus, tarik nafas, hembus, tarik nafas, hembus. So the liver tip is felt. Now we're going to palpate for any splenomegaly. So the same procedure, we have to ask the patient to inspire again. So encik, tarik nafas, hembus, 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 tarik nafas, hembus. Okay. The next, once we're done with the organomegaly palpation, we can proceed with drop space percussion to look for any splenomegaly or not. So we have to ask the patient to turn on his right side. So encik boleh pandang ke kanan, kanan. So the top space is the space at the area between intercostal space 9, 10 and 11, and make sure during the percussion it must be resonance, and if dullness is heard means it indicates that the patient is having splenomegaly. So now we can proceed. So the patient is resonance to drop space percussion, so the patient does not have any splenomegaly. So encik boleh baring balik. Then we're going to percuss for liver span. We have to percuss for liver lower border from the right iliac fossa, and for upper border we have to start from above. The percussion should be start from above. So we percuss from for the lower border first. So once the dullness is heard, there's the liver. That is where the lower border of liver. So we have to ask the patient to mark there. Cik boleh tanda dekat sini tak? Letak jari dekat sini. Okay. Then we have to percuss for upper border. So the upper border percussion should start from second intercostal space with align with the angle of Louis. So once the dullness is heard, we have to use a measuring tape and measure for liver span. Okay, ambil je. Okay. So it is around 6 centimeter. So the normal liver span is between 6 centimeter to 12 centimeter. So in this patient, this is normal case. So then we proceed with kidney development. So we have to place our left hand below the patient hip. Cik boleh angkat sikit. Okay, and then another hand on the patient's stomach, right side of the patient's stomach, and we have to ballot the kidney. And then proceed with the other side. In normal cases, kidney shouldn't be ballotable. Once the palpation is done, we can proceed with percussion. So we're going to do shifting dullness. If the shifting dullness is positive, we can proceed with fluid thrill. So shifting dullness. Once the dullness is heard, we have to ask the patient to turn on his right side and then wait for a few seconds, and then make sure that the dullness is still there. If the dullness shift means the patient is having ascites. So we can ask the patient to turn on his right side. Cik boleh pandang ke kanan. Okay, so we have to wait for a few seconds and then we can proceed with the percussion again. So the dullness is still there, so the patient does not have ascites. So the shifting dullness is negative. Okay, cik boleh baring balik. Okay, finally we can proceed with auscultation. We're going to listen for bowel sound for 1 minute, at 2 point of any side of abdomen, and then we're going to listen for renal bruit and aortic bruit. So we're going to use the diaphragm of the stethoscope to listen for bowel sound for 1 minute. Okay, next we're going to proceed with aortic bruit. Aortic bruit can hurt 2 cm above the umbilicus. Then we're going to proceed with renal bruit. So renal bruit is 2 cm to the right side and left side where the aortic bruit is hurt. So after abdominal examination, I would like to finish my abdominal examination with digital rectal examination. Once all the examination is done, we have to cover the patient and thank the patient for their cooperation. So terima kasih Inci untuk hari ini. And then we have to wash our hand right after the examination. So once all the abdominal examination is done, we have to present our findings to the examiner. Boleh tak saya tahu nama dengan umur?
Nama Rahman, umur 21.